copper tickets. So you can head over there and save a little bit of money in the process. All right, Dan joins us this morning. A lot of adults go to chiropractors, but I guess the new trend is to take your younger kids, even babies, to one, Dan.
And even at birth. That's been part of the interesting conversation I've been having here with Dr. Lisa Montez Wood, who's a chiropractor out in Fountain Hills. I understand adults going to a chiropractor because we get old, wrinkled, and wore out. But why babies? Why little kids? I would think they wouldn't have any need for a chiropractor.
And actually, a lot of problems can start from birth. And so that's oftentimes why I'm checking little ones, especially newborns or infants. Depending on their position in the womb or trauma during delivery, even what most people consider, an uncomplicated normal delivery, can put a lot of pressure on the skull and neck of a baby. And so that's mainly what I'm checking.
So what could possibly happen in a normal birth that we would need to bring in a chiropractor right away?
Well, when a baby, it should be delivered straight down, going straight to the pelvis, but depending on what's going on with the mom's pelvis, if there's some torque or restriction in there, when the baby's in there, the head could be flexed a little, extended, in an odd position. And so when it's tried to deliver, then that's a lot of force put on that shouldn't be put on there. So if you see babies, most people know cone heads aren't a great thing, but there can be subtle differences too. If you go and brush over your baby's head, it should be very round. So if you feel ridges or a flat spot or things like that, then you know that the skull bones, when they overlap during delivery, didn't pop back into place when the baby cried or, had their first breath, and there can be an overlap there. And so you're doing some very gentle techniques to try to restore the shape of the head, and checking out the neck as well to make sure, because the nervous system controls everything in the body. And so if there's a problem with those joints as far as motion or movement, then it can give problems anywhere in the body. And so we'll see those later on.
This baby we're looking at here, obviously you have to take care of a little baby like this much differently than some big bruiser guy coming in, right?
Right.
Are you manipulating just like you would an adult?
No, it's very different, especially when you're dealing with a newborn. This little one is 5 months old. It's just a pressure. It's a very light pressure. If there's an area of restriction in there, each joint should have a certain motion or spring to it. And so if you feel a restriction, you're basically applying just a little bit of pressure to restore that motion and help the body to function as it should. And when I'm dealing with the skull, the amount of pressure I have on there is like the weight of a nickel on your hand. So it's very, very light. And a lot of people think, how can that be doing anything? But if you imagine, like, let's say a toy sailboat on the water, if you were to pull that hard, the nose of it would go right into the water and you'd have a lot of resistance. So when you're dealing with the skull, you do have pliability there, but you have to gently glide that boat over the surface of the water, and that's how it is here as well. You don't want those tissues to resist.
Now you're working with somebody a little bit older. What would be an instance where you might take an 8 or 9-year-old to the chiropractor?
Most of the time with newborns, it'll be situations like not nursing properly or colicky babies or things like that. In a little bit older children, one of the primary things would be ear infections, constantly having ear infections.
Now that's a spinal problem?
Yeah, it very well can be, because basically if there's something going on in the neck, and the muscles are tightened in that area, the lymph nodes cannot drain. So anytime the child has any congestion at all, then it cannot drain down. And so you can give them antibiotics, and it takes away the infection, but the problem is still there. And so oftentimes, doing some gentle adjusting in the upper area of the neck, the child no longer has issues because it's functioning the way it should.
Are you like one of the only pediatric chiropractors?
No, there's a few.
With obviously your office is set up for kids.
Yes. Yeah, not all chiropractors are comfortable treating children, especially the newborns, but, for the most part, there are a few throughout the state, yeah.
Really? Well, we appreciate you coming down here. It's really
so
fascinating,
much.
Tara. I would never think about that, but you know what? It's really something good to think about, because we lived with a lot of ear infections over the years when our kids were younger.
It's just that noise when you get that adjustment.
Well, you don't have that with newborns.
I know. I hope not. All right, thanks very much. When we come back, we'll have a look at the forecast. Brad will